Hey, welcome. I am Wendy from Family in Focus, and tonight we're going to be talking about eating disorder prevention for families. Before we dive in, I'm going to ask you one very important question. What's going well for you right now? Something that we can celebrate. Perhaps it's something for you, for your family, maybe something in your health. What's going well? Taking a little moment for you. You got it? All right, so here's why we're looking at this. If I asked you right away, what's something that you're struggling with? Maybe something that you're having to address right now. What's a problem you have? I bet you could come up with it really quickly, perhaps even quicker than something that you want to celebrate. We're hardwired for that. So we are hardwired for threat detection to find the things that are going kind of sideways, something that's wrong, something that needs to be fixed, because that's how we survive. We address it. Well, first we identify that there's a problem. We address it or fix it so that we can survive to the next day. Ah, interesting. Okay, so it's a survival mechanism. But here's the thing. In our day and age right now, I got to tell you, it sure seems like there's a whole lot of things that are catching the attention of how we need to fix it, address it, deal with it, diagnose it, treat it, all the different things. Heck, like my to do list, okay? If I start thinking about what it is that I need to do, it just keeps on going, keeps on going. There's always more that I need to take care of. How does that make sense for, the where we are right now, but also all of the overwhelm and fatigue and all the like heaviness that we're carrying with us because we're just trying to survive to another day, but we're carrying all of this burden with us. So this is what we're doing right now. We're looking at what is it that is going well in our lives right now. That is rewiring our brains to be able to start focusing on what is going well, what we want more of in our lives. I think of that as setting a foundation. So, kind of finding the things that it's not feeling overwhelmed and we're being scattered like we were over here. But here, when we find what's going well, we're going to build upon it. It's steady, it's sturdy, and we're going to keep on going and building because what we focus on, we create more evidence for it. There's a concept, another name for this is appreciative inquiry. What we appreciate appreciates, in the words of economics. And so, as we're rewiring here, we're going to start building a foundation upon which we're going to grow. So, now let's switch to our topic for the evening and start bringing that with us as well. Okay, so eating disorder prevention for families. As a quick introduction, okay, so hi, I'm Wendy Schofer, MD. I am a physician, a pediatrician, and a lifestyle physician. Now, I want to acknowledge as we're talking about eating disorders, as we're talking about health, I am a doctor and I am not your doctor. I am not your family's doctor. So, what we're going to be talking about tonight is in the realm of really awareness and education and looking at patterns. It is not medical treatment. None of this is to be taken as creating a patient physician relationship. Please maintain your relationship with your physician and tell them I said hi, please. Please do. Okay, so let's move on. But here's the thing, as a physician and as a mom, it has really been striking to me how over the last decade in particular, we have seen an increase in the rate of mental health diagnoses and the struggles in our families, and along with that, eating disorders. So, eating disorders are not just a weight concern, it's really looking at how it is a mental health concern. So, seeing the increase, and I don't quote the numbers because to be honest with you, You're going to find different rates that are out there, okay, depending on which study you're looking at that different time frame. But I will generalize here, okay, that there has been a significant increase in eating disorder prevalence, okay, over the last decade. In particular, it has accelerated in the years of COVID, okay, with the pandemic and afterwards. It's continuing to increase. And there's so much more that we can look into about this. So one of the things is that, with eating disorders, it used to be considered a concern of young adults or adults in general. But now we're seeing it younger and younger into early school age early school age children are also experiencing concerns about eating disorders. And so with this, I keep on thinking about, okay, as we're having this increase in diagnoses and the need for treatment and the need for hospitalization, how can we get ahead of that? How can we truly prevent? And in order to do that, we need to be able to understand where the concerns are coming from, what is contributing to eating disorders, and what we can do as a primary in our home, in our communities approach to be able to prevent it. All right, so let's look at a couple of things here. So, as we look at kind of like the contributions, the contributing factors to eating disorders. There's a number of different things. While we can't say that there's one set factor or one set path for creating an eating disorder, we do know that there are um, increased likelihood in families. So we are questioning about, genetic contributors, also familial environments. But there's also increased rates of eating disorders for those who experience mental health conditions. So anxiety, depression, obsessive compulsive disorder. When there are efforts to lose weight, so specifically in weight management, in dieting, in weight loss scenarios, that we start seeing increased eating disorder prevalence. And that's actually something that's really been catching the attention of those of us in pediatrics that are looking at families who are, really trying to address this increasing, the concern that we have in the community about the increasing rates of metabolic conditions and weight concerns, overweight and obesity. And we're also, along with that, seeing significant increases in the number of children who are struggling with eating disorders. And the other very harsh reality is that it's often under uh, recognized, underdiagnosed, because these are children who are in larger bodies. And so they're not fitting the classic picture of a child with an eating disorder, such as anorexia, who has a smaller body size. And so these kids are not being recognized. They may actually be commended for their weight loss and not being noted about how there is a disordered eating process that's going on in the background. Um, and so that's where, really kind of catching the attention, why I want to try to get as far ahead of this as possible. Now, in our community right now, I live in an area where we have outstanding medical institutions, and we're having a fabulous approach to mental health for children and being able to get them connected. And yet finding that we do not have the resources available to really address all of the concerns about eating disorders. And how can we address that as early as possible to prevent it in the first place? And that's what we're here tonight to do. Okay. What is it that we can do as physicians, as parents, as community members to be able to address the concerns for ourselves as well as the children in our lives, because this is impacting them as well. So I'm going to not go through all of the definitions, but I'm going to ask you to listen for a couple of patterns in descriptions. Okay, and this is from the Mayo Clinic, just taking some of the definitions of different eating disorders about the symptoms, actually. Listen for the patterns. So anorexia, okay, talking about how it's a eating disorder that includes an unhealthy low body weight, intense fear of gaining weight, and a view of weight and shape that is not realistic. Often involves using extreme efforts to control weight and shape. Often cutting out certain kinds of foods or food groups. The emphasis, of course, is mine about the fear, the emotions that are involved, and the control. So, controlling body, controlling eating, controlling food groups. Bulimia, often, it includes episodes of binging and then commonly followed by episodes of purging. And it involves often eating a very large amount of food and feeling like there is no control over the eating, and that they can't stop after eating due to guilt, shame, or an intense fear of weight gain. Purging is done in order to get rid of the calories. Bulimia also involves being preoccupied with body weight and shape, and with a harsh self-judgment of personal appearance. So binge eating disorder is a third consideration, or a third diagnosis, involving eating food, a large amount of food in a short period of time. Again, feeling like there's no control over eating. And again, there's a great deal of guilt or disgust or shame afterwards, may fear gaining weight. So just highlighting here about, we often think of eating disorders in the context of what is being eaten or not, and the body weight. But I'd like to highlight about how there's patterns of emotions, emotions around food, emotions that are driving those eating behaviors, and the emotions that we're feeling after the eating, as well as patterns of control. And I think that that is something that we really can start looking into, as far as how do we address eating disorder prevention. So think about this. So if we're going to prevent eating disorders, if we're going to avoid this, what is it that we want? Which is kind of like a different kind of conversation, but we're looking at, like, I desperately want to avoid this. I want to avoid this. Well, what is it? If I don't have that, what is it that I actually want to be going towards? I know when they were teaching me to drive, this worked some days better than others. And like when you're losing control of the car, skidding. So I was raised in Pennsylvania, so they were always teaching us that if you get on black ice, what do you do? And they said, don't look at the thing that you're trying to avoid, because you always go towards it. Look at the open space. Look at the place where you want to go, so that you can actually redirect your vehicle moving in that direction. And I got to tell you, I totally have a great example. And there is a fire hydrant with my name on it in Bethlehem, Pennsylvania, because when I was actually on that black ice, I totally looked at the little fire hydrant and I took it out. And thanks to my family, they've never let me forget that, but I won't forget it. And thinking about that with eating disorders, okay, I don't want to go there. I don't want to go there. Well, what is it that I actually want to see for myself, for my family? If there isn't disordered eating, what is there? And so when I ask that question, a lot of times folks will say, well, having a healthy balance of foods, of food variety, of eating when hungry, stopping when satisfied. Okay, sounds good. Sounds good. But what does it really look like? Like in the day to day, like how do you know when you're doing it? How do you teach that? A lot of parents will talk about how they want to create healthy relationships with food, with body. What goes into that? Just think about like, how do you know what your relationship is with food or with your body, with yourself? Who defines that? What goes into it? And that's where a lot of the work that I have done outside of the clinical office, I've been starting to really apply that here in my medical practice as well as in the community. And that's about relationships. So this broke my mind when I first encountered the concept that like you can't tell what a relationship is from the outside. So like nobody can know what my relationship is with food just by watching me eat. I was like, well, yeah, I mean, look at that. Like they love food. I'm using this, I'm switching back and forth between me and them, but how many times we talk about how, my child loves food. I'm really concerned about their relationship. When there is, right now it's Christmas time. And so when there's Christmas cookies out, they will eat those cookies. Like, oh, well, what do you actually know about their relationship with food? You just know that when there's cookies out, they will eat them. The relationship is based off of not what it is that we're doing and just looking at it from the outside, but understanding why we're doing it. The thoughts and the feelings that are leading us to eat. The thoughts and the feelings that are leading us to have particular behaviors. So, if you've ever done any work with cognitive behavioral theory, this is exactly where that's coming from. Okay. So, our emotions are like the fuel for everything that we do in our lives. Every behavior that we take, every action that we do, everything that we like grossly avoid, like we do not take action, is because of a feeling. Either a feeling that we want to have or a feeling that we are desperately trying to avoid. Let me give you an example. So, I've found that when I come home from a really long day at work, I find myself, oh, I'm so tired. I'm so tired. And I find myself walking to the pantry. And I open up the pantry, and what do? I grab those tortilla chips because you know what? They are really good. And I notice it's not that I'm hungry, it's that I'm tired. I'm exhausted. So why am I reaching for the tortilla chips? Okay, well, surface level, because they're good. Okay, again, because it's a habit, it's something that I've done a whole lot. And then another one is going to, well, because I'm tired. But eating tortillas does not fix tired. It doesn't fix exhaustion. What it's actually doing is distracting me from what it is that I'm feeling. So, because I'm so over feeling exhausted, I'm turning to the food in order to make me feel better. Interesting. Interesting. So, noticing that we have emotions that lead us to, eat in certain ways. And I'm just using the particular example of a behavior of eating, since that is largely what we're doing here. But think about what happens if you're fearing. Fear that you're feeling for whatever reason, whether it is, fear of eating, whether there is an anxiety or a fear in your life, and how that can impact your eating habits. Perhaps you're trying not to feel that anxiety or that fear And so you're turning to food in order to feel better. Perhaps you're trying so desperately to feel better that you turn to that food until you feel ill. You feel like you don't have control over it. Just noticing what's happening here. And I'm removing any kind of diagnosis. I'm removing any kind of label about it because right now we're just looking at the patterns. And that's really what we're looking at with eating disorder prevention, is to really start understanding, well, what's operating in the background? What's just happening? The patterns that we're noticing of emotions that lead us to eat, lead us to not eat, the emotions that we are experiencing in our lives. What are the beliefs that we have around what is healthy, what is unhealthy, and how is that impacting the emotions that we're having around different foods? So one of the big things that I explore with folks that I work with, whether it's physicians or parents or adolescents as well, around eating, is really the relationship that we have with food, and really getting into, well, what is it that I'm feeling? I think the emotions are really the glue of all of this, like to understand the emotions that are happening here and to get really curious about them. We haven't been taught to do this. We really haven't. I mean, we're starting to get more and more social emotional learning in the schools with kids. So thankfully, they're learning it. But I got to tell you, as adults, we're lagging. This is not the language that we were raised with, and it's new. It's new. I mean, how often have you heard about, looking at the emotional environment in, for a person in a home, in a setting, to be able to understand more about medical conditions? Well, that's where we're going. Ooh, yo, cat, cat. Okay, my cat just attacked my feet. Okay, okay, there you go, the break. Oh my goodness. The other thing, so talking about relationships, bringing it back here. Um, Next thing, going back to the words that I was highlighting before about control. Control of food, controlling the body, maybe feeling there's a lack of control. So another factor to consider, we spoke about the relationships. Let's look at that word control. I highlighted it in a number of the different conditions, as I was reading from the Mayo Clinic outline. And with eating disorders, there's concerns about controlling the body, controlling the size of the body, controlling the eating, the types of foods that are being eaten, or perhaps feeling like there is a lack of control. So I want to look at control in particular. There are so many ways right now that we really feel like we are out of control. Like there are so many things that are just beyond us. So whether we're looking at environmental factors, whether we're looking at geopolitical, whether we're looking at medical conditions and diagnoses, family dynamics, what happens, with other people, even what other people say to us, and then how we feel about that. So, with the other people saying things like for children, being in environments where there's bullying, being in environments where, say, with COVID, we all had, so many things that were outside of our control. How did that all contribute to how now we're just trying to desperately hold on to control, and how some may take that to controlling their food or their bodies? And also the distress that is experienced by those who feel like they're out of control. Now let's look in particular with kids. It's really hard to be a kid. Okay, as much as we want to make all sorts of, stories about how it's the best time of your life and everything's fun, no, let's talk about this. Kids don't have control over their lives. There's so many different areas where they're being told what to do, how to be in certain, environments. How does it make sense? The kids struggle with trying to find control, and that some may turn to controlling different aspects like their food, their body. Interesting. Again, we're looking at patterns. More so than anything, the best prevention is awareness. If there's nothing else that you get from this conversation about how the best awareness, or excuse me, the best prevention is awareness. Because when we can start looking at the patterns, we become aware of it, we can start understanding more. And sometimes it's about understanding not to fix, but to be able to actually just understand what is going on in the first place, not waiting until we're getting to a place where it's a crisis, but starting to see the patterns of what we and those in our lives, so our family members, those that we care about, our patients, our students, are experiencing. So another part, so if my goodness, where do I want to bring this in? So there's a book that came out in this past year called The Anxious Generation by Jonathan Haidt. I think it's Haidt. And it is a wonderful book that highlights the increase in mental health struggles by uh, our youth, in our youth over the past 10 years, that's aligning with the increase in social media use, using phones as communication devices and having it with us all the time. And I keep this in mind with the amount of association of anxiety with disordered eating. Also highlighting with the use of social media, the use of, or the readily available comparisons to different ideals that are being promoted, but not necessarily being critically thought about. So if you think about the images on Instagram, as kids are just kind of scrolling and they see everybody is in, these beautiful places and spaces and their bodies and their food and everything just looks chef's kiss, absolutely beautiful. Dude, that is so not real. How do we check that? How do we apply critical thinking to say, oh, in this environment, we are seeing all of this that it's not real. And it's actually increasing our anxiety because we're seeing that there's this huge gap between where we are, which is, by the way, completely where we're meant to be and normal. Okay, because that's the human experience. We're everywhere. We all have different places that we are. There's not somewhere that we all need to get to say that we are worthy or beautiful or healthy. So many of these messages that are out there, we're seeing this big gap, that big comparison, and it's contributing to the anxiety versus seeing where each and every one of us uniquely is right now. What are you celebrating? Remember that question? What's going well in your life? How have you grown? What progress have you seen? So instead of focusing on that gap from where you are to some arbitrary place or ideal that is not something that you created anyway in the first place, it may have been put out there and you may agree with it for some reason, but how about looking at where you are and seeing how you've grown, how you've developed, how you've progressed? So the book that really aligns with that is The Gap and the Gain by Dan Sullivan and Dr. Benjamin Hardy. And so another good book to look at to further, kind of support this approach to how do we support healthy habits from the inside out for ourselves, for our family members. This is what I do with Family in Focus. So I founded Family in Focus in order to be able to really change that conversation about not waiting until we're identifying diagnoses and treating in the office, which are all valid. Like, yes, absolutely. There will always be a role for doctors to be able to do that. And yet, I want to be able to prevent. I want to be able to really be able to understand what is going on the inside. So, those thoughts, the emotions, the behaviors, what is under the surface when we're just looking, if you think about that iceberg analogy, we talk about weight. Even when we talk about the behaviors that we can see on the outside, we're just seeing the tip of the surface. We don't understand everything else that's going into it as I'm drawing my, iceberg here. So, the very tip is the weight. And underneath the surface is everything that has gotten to that contribute to it. So the beliefs, the emotions that are driving all the behaviors that are contributing. Well, that's what I do with Family in Focus, is to be able to really start understanding so much more about what is, leading to this particular number that's on the scale, this particular, body size, this particular approach that I have to eating or to how I'm talking about my body. So the work that I do with body image or with habits of all sorts of different types. So trying to understand more about that, because this is what's happening for all of us. We all have thoughts and emotions and behaviors. This is what makes us all uniquely human. Uniquely human. Oh, there's so much more. So, um, anyway, bringing back to one more thing. Okay, one more thing to really be able to start looking at eating disorder prevention for ourselves and our families is to just slow down. To slow down. Now, remember that part about how we are hardwired for threat detection? And of course, as soon as we spot a threat, we're like, we are on it, like white on rice, because that's how we survive. We want to move quickly. But the thing is that we are exhausted from everything being a crisis. And the more that we can slow down, get ahead of this to start looking at the patterns, being aware, having an understanding, do you see how this all fits together? Slowing down to be able to identify concerns earlier, to actually maybe not even get to the point of concern, to be able to say, I know what is going into this emotional environment that I have around food. Those eating behaviors, I know where they come from. And I can also perhaps address the anxiousness that's in the background here before it starts impacting how I'm eating or how my family member is eating. Trying to get ahead of all of that. That only happens when we slow down. Because when we're going really quick and everything's in a crisis, we have blinders on. And so, in order to be able to really appreciate patterns, we need to slow our roll. It's a vastly different approach than what we've been practicing for at least the last 10 years, conveniently, that same time frame that we're seeing all this. So I would love to know what it is that you're noticing as you're hearing about, focusing on relationships, really kind of being aware of this kind of dance that we're having with control, the patterns that you're seeing, perhaps that underlying anxiety, that anxiety that's just kind of humming in the background. And then slowing down. So I welcome you to connect with me in a number of ways. First of all, you can always drop me an email, wendy@wendyschofermd.com. I'm also going to put in the notes for the replay a link to connect with me directly. Because what we have an opportunity here to be able to work together, to be able to apply these concepts to your life, your family, your school, your environment, whatever it is, your clinical practice. We can apply these in your unique life to really be able to understand, okay, well, what about my relationships with my food, my body, my body image? How do I help my patients navigate all of this? These are the types of conversations that we can have. So I'm going to put the link in so that we can have a consult call just to be able to see what that looks like, to be able to work together and be able to continue with this work for our benefit, for our family's benefit, and for that of all the folks in our community, whether you are an educator, whether you are a physician, whether you are a community member, a grandparent, all of the different ways that we are able to connect with those in our, in our community. So, so much love to you. Thank you so very much for joining me this evening. And I will look forward to being in contact with, or for you being in contact with me. How about that? All right. Much love. See you soon.